About the shortage of those in-demand N95 respirator masks. The state's now teaming up with a technology-based nonprofit to decontaminate these masks so they can be reused. Channel 3 New Haven Bureau Chief Matt McFarland is live in the Elm City now with all the details. This is intriguing, Matt.
Yeah, Dennis, and this is set up at an old Department of Transportation warehouse here in New Haven. The decontamination process will be running 24/7. We're told from start to finish, when the hospitals drop off the masks to when they're clean and they can get picked up, should take about 3 days. And right now, this location, just one of 7 sites in the country doing this work.
It's testing and masks.
And until the supplies of N95 masks can be replenished around the country, Battelle, a research and development organization, is doing its part to decontaminate the used personal protective equipment that's hard to come by.
We can do tens of thousands each day. So, there's about 5,000 per unit, and so we have 4 units.
And with 2 cycles a day, that's 80,000 masks. So how does it work? Hospitals and healthcare providers will collect the used masks and ship the PPE to this site in New Haven. That's where Battelle set up its critical care decontamination systems in these shipping containers.
This site is a very proactive way to make sure that we're keeping our healthcare workers healthy and safe.
The masks will be labeled and barcoded with serial numbers so they can be tracked, ensuring hospitals get their own masks back. Then they're hit with vapors of concentrated hydrogen peroxide.
It's a vaporized hydrogen peroxide that the masks will be in. It's a couple of hours, about 2.5 hours within that solution, and then they're sort of degassed.
4 years ago, Battelle published research after looking into what would happen if a national pandemic caused a shortage of masks. So when it actually did, it was able to scale up quickly. According to Battelle, it spiked N95 masks with the coronavirus for its testing, saying no viable signs were recovered in the samples following the decontamination. So far, roughly 3 dozen hospitals from Connecticut and the region have signed up, with more expected. And we're told each mask can be decontaminated up to 20 times before its effectiveness is impacted.
This is a part of our strategy going forward, working collaboratively with Battelle and our other private sector partners, doing everything we can to stay ahead of this virus.
Now, here's the best part. It doesn't cost the hospitals. This is being covered thanks to a grant from the federal emergency stimulus package passed last month. And while it's masks right now, Battelle says it's also doing research to see if this same process will work with goggles and face shields. We're live with the mobile newsroom in New Haven. Matt McFarland, Channel 3 Eyewitness News.
Okay.